Hi, my name is Faith Worthington. I am the trauma nurse educator at UPMC Susquehanna. I'd like a few minutes of your time today to review the PHRN training that I'd like to develop at our hospital. Our hospital is a part of a 6-hospital system within central Pennsylvania. The actual facility I work at is a rural hospital with 256 beds, and we're working on becoming a level 2 adult trauma center. We want to be able to provide that world-class care to our community. So currently, we do have a level 1 adult and pediatric trauma center, but it's about 45 minutes from our area. When patients are transferred to those other hospitals, it's very taxing to our patients and our patients' families in order to be able to visit and care for them. So if we're able to provide that care here within our own community, it's going to help raise those patient satisfaction scores. Our emergency room has 36 beds with 2 very large, very beautiful trauma bays. We were remodeled about 5 years ago, and they had plans back then on us becoming a trauma center. One of the other things that's very unique to our system is that we have our own emergency services. So our hospital owns our pre-hospital services. Our paramedics and EMTs are all employed by the hospital. Their surrounding stations actually have contracts where our ambulances will sit within their own fire stations. We're also a primary stroke center, and our rehabilitation center also has advanced certificates, such as our spinal cord injury. So we have the ability to care for these patients within our system. Our mission is to extend God's healing love by providing outstanding patient care and shaping tomorrow's healthcare through clinical and technical innovations and education. Our vision is to create an integrated community healthcare system that develops world-class care. Our values are to carefully place our patients and their families first, share ownership with all caregivers, and lead with a servant heart. Our hospital is a faith-based hospital, and you can tell that by our mission and our values. So some current issues going on. Our emergency room staff is very inexperienced. About a year ago, we lost a large number of staff, and they were replaced by newer staff and/or staff that was once graduate nurses. They all received their 6-month worth of orientation, but to become a fully experienced emergency room nurse, it does take years of experience. So we do have that need for having advanced critical thinking skills within our department. The thing is when you work in the emergency department, there's always a doc there, there's always a provider there to come behind you and help you with whatever thing might need in the department. So if it's, the critical thinking skills or just having questions regarding that patient care, there's always a provider there for your backup. Now, as talking about providers, our providers are actually locums. So we have just a few handful of staff, providers, doctors who are with our own employees. Most of them come in for a few weeks, they leave, and we never see them again. The ownership just isn't there. Now, we do see about 140 patients per day on average, and we do have the opportunity, again, to partner with those emergency medical services just because they're our own employees. Now, some strengths that I had mentioned, we do have that emergency medical services within our own staff. Faculty works very closely with our local paramedics. They do bring our patients into our hospital on a regular basis, but we have the opportunity to strengthen that partnership along with working with our EMS program director and our manager. We want to be able to develop other trainings previously to prepare nurses to care for trauma patients. And like I had mentioned, some of our emergency room nurses do need that critical thinking skill. And we do have some that are already pre-hospital certified, but I feel we could definitely use some more. Now, some weaknesses is that our critical care transport is lacking at the moment. We are working on becoming a facility that has med stat medevac as well, which will be air, which will also require some registered nurses to be PHRNs there as well. Emergency room nurses are not trained on state protocols. So if we were to have this course, the nurses could have a better understanding of those state protocols and the treatment their patients are receiving before they get to the hospital. Like I said, as far as opportunities, we have that gap in the fact that we do need some critical care transport trained staff. And of course, emergency room definitely can use some additional training as far as the treatment pre-hospital. Threats, without the properly trained nurse support, the candidates will come from outside our system, especially when we do get that helicopter at our actual facility. The local college doesn't appreciate the need to have a pre-hospital RN training course, which is where most of our paramedics students are from. It's a local college. Working full-time and completing the course does take dedication from the nurse, so this is not something that can be completed in a weekend. It would be a few months in order to be able to complete this course. And of course, there is the cost that we'll have to incur in order to complete the course. Most of the folks that would be involved with this, I would ask for them to volunteer their time, but there may be those outside people that aren't in our system that we would need to provide that cost for them. Now, our goal is to develop and offer that PHRN course inside our hospital. Staff trained for critical care transport, we talked about, and we want to also improve our patient care. The nurses will also have that better understanding of their pre-hospital roles and responsibilities. As far as the key stakeholders, we have quite a few. So Karen Zenoble is our Executive Director of Emergency Services. So she oversees both emergency services pre-hospital and also the emergency room. Tony Bixby, he is the Director of Pre-Hospital Services. Dr. Gregory Fraley is our Program Medical Director for Pre-Hospital Services. Starlet Bixby is our Trauma Program Manager. Julianne Gambosi is our Director of Education. And then we also have other key stakeholders, which would be our emergency room and possibly even our intensive care staff. And then patients that we care for within the UPMC system would all be considered stakeholders for this. Now, as far as the strategy map, most of these things we've talked about, but it's all about building better relationships with our pre-hospital staff. But it's also the development of those advanced skills for our ER staff. The ER staff will be able to have the skill of, let's say, intubation. So the registered nurses currently do not have the training or the skill to be able to intubate patients. With becoming a PHRN, those nurses will have the advanced skill in order to intubate. And just last week, since I'm taking this course and I've had the training, I was actually able to help a provider with the intubation of a patient. It was a difficult intubation, and there was only one provider on at the time. I was the second hands. If I didn't have the course, I wouldn't have had that opportunity. And I feel that staff will have a better appreciation of the critical patients that we take care of. I know for me, one of the big things, a reason why I wanted to do this is because I wanted to develop myself with those new skills as well. As far as the action plan, this will cross a few different functions. So first off, we have the registered nurse or the bedside nurse. We have the course coordinator, which would be myself. And then we also have the presenters, which would be coming from the pre-hospital world. That would be your paramedics and your EMTs, excuse me. And then we want to be able to do this by management of objectives. So the things that we're going to be training on is actual EMT training. We want to train on international trauma life support, which is the ITLS. We also want to have clinical time in the field and partner with anesthesia so that we can actually get operating room time for intubations. And then we want to be able to evaluate the care provided to our patients. As far as communication, first off, we would start by communicating at an emergency room staff meeting, letting them know we are going to develop this course. We would then email to gain the list of those who are interested in the class. We would then start formal meetings to share the plan with the stakeholders. So this would be meeting with Karen Zanoble, Tony Bixby, Gregory Fraley, in order to be able to set this up and get their final approval. Once the final approval happens, we would then reach out to the paramedics and EMTs to see who would be interested in helping develop the program as far as presenters. Once it's all over, as far as the evaluation, we're going back to that balanced scorecard that we learned about again this past week. We want to put our mission, vision, and values right at the heart of what we're doing. We want to be able to have better outcomes for our patients. We want to be able to provide financial responsible care. So care that's not too expensive, that we're not having to do many tests in order to determine what's going on with our patients. We would start to do that with our Press Ganey surveys. So currently right now, our Press Ganey surveys are not what we would hope they would be. We definitely have some opportunity for improvement. And I feel that this would be a great opportunity to improve those scores. Again, patient feedback will be another way of evaluating the program. And then we'd want to reduce or have a reduction in those adverse outcomes. I appreciate you taking the time to hear out my presentation today, and I look forward to hearing all of your questions regarding our PHRN course. Thank you.